Hi, everybody. This is Dr. Corinne Menn, medical advisor and prescribing doctor here at Alloy. And today I'm very excited to be doing an Instagram Live where we discuss how we deliver menopause care via telehealth at Alloy. And I'm going to be introducing you to that we have. And she will be joining us. Her name is Dr. Michelle Montville. And we really want everybody in our audience to start to meet the amazing doctors who are on the other side of the screen who are seeing you. So there she is. Hello, Dr. Montville. How are you?
Hi, Dr. I'm great.
So thanks for joining me here. These are fun. We're going to keep this one short and sweet, but packed with all the information that anybody watching or who watches this reel later on needs to know about how we deliver menopause care at Alloy and a little bit about like the doctors and why it's like a pretty special, platform. So anyways, I introduced myself already. So why don't I give you the floor to introduce yourself?
Thank you. So I'm Dr. Michelle Montville. I'm a board certified OBGYN. I have 20 years experience providing women's health care. I'm also a certified menopause specialist and a prescriber as well as the clinical director at Alloy.
Awesome. And maybe just jump in and just talk about like what you're doing at Alloy. I mean, we're going to talk about how we prescribe and how we work as doctors. Maybe talk a little bit about what other work you're doing as a clinical director and, to give people an inside scoop.
It's a very fun and rewarding experience. As the clinical director, I get to collaborate with experts in the menopause field, wonderful minds, really forward-thinking people at the company who want to bring menopause care to the forefront of women's health care. So I help develop educational opportunities for the doctors so we keep the conversation going about what the evidence is and how to best approach menopausal care. Help support the doctors to help them be able to do the best job that they can in providing that service. And just being part of this menopause movement that I'm just so proud to be a part of.
Well, we're so happy to have you at Alloy. So I think we want to really tackle a bunch of questions about like how Alloy works. How do we deliver menopause care, why it works, why it's special, why it's unique. So why don't we just talk about basically what is Alloy? So I'll let you answer that. And then maybe you can talk about the intake process, like what it means for a patient. And then maybe I can then follow in how, once it gets to the doctor, how we function from the
Yeah,
doctor's side.
perfect. So Alloy is a telemedicine women's health service. And what we do is we provide personalized care for women that are seeking menopausal hormonal therapy for relief of their menopausal symptoms primarily. We connect the patient with an expert in menopausal care. So they're all physicians who are well-versed, experienced, and very comfortable providing hormonal therapy. And so we provide FDA-approved hormonal therapy that actually gets shipped directly to the patient's door.
So, and then just to add that, so we're giving patients access to high-level, super specialty care. We're not replacing anybody's local gynecologist or local, primary care doctor. We work as a complement to them because, as you and I both know, and I think many people in the audience know, most physicians are not trained in menopause. So even if women are knowledgeable from what they hear on Instagram or in other sources, then they try to go to their doctor and they just can't get care. And so it's not their doctor's fault necessarily. They weren't trained, right? So we're offering that kind of expert level of care. And it's not just, we'll get into the different products too. It's not just that they have access to menopausal hormone therapy options, and we can go through the list of other things. There's also skincare and sexual health care. But do you want to maybe explain like what is the platform? How does it work? Like someone comes to Alloy, what's their intake like?
Yep. So it's really really quite simple and easy. So the patient comes to myalloy.com, and they fill out a medical intake form that's actually very specialized and focused on what their menopausal symptoms are. And so comprehensive in that sense, but just very laser focused on those complaints. That then gets reviewed by a specialist who will create a personalized treatment plan and recommendations for menopausal hormonal therapy. And so in that process, the patient actually has direct communication with that prescriber or that physician, and to be able to explain their situation and their symptoms and their concerns, ask any questions. And then once we come up with a plan that the patient is comfortable with, they understand, they're happy with, they've been involved in that process, we send them their prescriptions directly to their door. Just really quick.
And I think it's interesting. Alloy is an asynchronous platform. So it's important for patients, I think, to understand what does that mean and why is that good, right? So this is not a video phone call with the doctor, but it's unlimited messaging back and forth with your doctor that you're assigned to, who's licensed in your state. And I think it's nice for us to point out why this is actually really interesting, and it's a different take on maybe what patients are used to with an in-person visit, where it's a lot of talking back and forth, and there's certainly pros and cons to everything, but I'd like to point out some of the things that I think make this kind of process kind of special. One, that you said we have a really robust intake form, which is super specific. If you're coming only for some skincare stuff, it's going to be a skincare only form. But if you're talking about menopausal hormone therapy or perimenopause, birth control pill options, non-hormonal options, it's a really in-depth intake form. And then it gets sent to you or I or one of our colleagues. And I know for me, from my perspective, there's a lot of great information there, and it's given to us in a really clear manner. And I can really sit with it and say, I can, if there's something more interesting or complicated, I can go back and forth with the patient. Whereas it's a little interesting when you have only a 10-minute visit at your annual OBGYN, you don't have that luxury of a little bit of space to kind of really take in the patient's, information and then be able to communicate back and forth. What would you say about that?
I would say that, I mean, it's already a different experience because the majority of women, when they go for their well woman visit or their annual visit, they're not even given the opportunity to describe what their symptoms are. Those questions aren't even asked. And so, already in that first contact that you have through our platform, we know what those symptoms are. We want to know, we want you to tell us like what your experience has been like. So already in that sense, that experience is already, I think, very different for a lot of patients to just ask the right questions.
And actually, I think you pointed out to me that those questions are an education in themselves. Because when patients realize, like, wow, someone's asking me more than just hot flashes and night sweats. Mm-hmm. They're asking me like a huge inventory of things. And I think for a lot of patients, they're like, wow, it wasn't until you asked it that I realized, wow, this is a part of what I'm experiencing. So that's a really interesting point that you make there. And so the consult is that we're getting all this information, and then we have this unlimited back and forth, which I have found really interesting and useful because I can give a patient a large amount of information, an explanation of options, and they can have the time and peace to just kind of think it through. If there's something in their history that I need a little bit more, and I can ask them, or if I just wanted to explain their options, they can think about it. They've got some time, they can get back to me, and then, like you said, we'll come up with a final treatment plan, which then we send to, they've got their own dashboard, right? So they can see everything beautifully on their dashboard, and then they can choose what they want to move forward with once we say, these are your options, right?
Yeah, and so, back to your point about how unique it is, it's, already that entire process eliminates so much of the inconvenience of trying to get care for women in this stage. It eliminates the logistics of having to call the call center and make an appointment, and do they take my insurance, and okay, do I have, can I take off of work to go do, this appointment, and, maybe the doctor's running behind, or they have to reschedule, or, all these things that we all experience as patients in the healthcare system. It
Yes.
takes away. It just makes it so much more accessible, convenient, and easy. And that flexibility, I think, is really important, like you pointed out, because sometimes this is the first time patients are getting all of this information, and it really gives them time to process it.
Yeah.
Um,
And then we're available for them afterwards. So that's not the end of the interaction. So I might decide on a plan. The patient might start whatever we decided on, but then she has unlimited access to her doctor, as well as, of course, our support team. But the messages primarily go right to the doctor. And so we can help them with things like side effects, or they're not having enough symptom relief, or things have changed in their medical history. Now they're gone from perimenopause to menopause, or they want to add something else on, something from skincare, or something with sexual health. And sometimes it's just a quick little question. Other times it's like, hey, we really need to. And so we have that other consultation. And so their initial consult fee, because people are asking us a lot about fees, so we should just talk about how that all works. But that initial consult fee that they're paying, it includes our expert recommendations, but also it includes all of this unlimited accessing. And then, like you said, we're sending their prescriptions directly to them. So we don't work with insurance, but our customer service team can provide you with an itemized receipt, and you could submit it to HSA, a deductible, and it's really interesting. I found out myself with my HRT when I was getting it prior to being with Alloy, that my copays for my patch, my vaginal estrogen, my progesterone, it all added up to a significant amount every month. And then if I added in the copay to go see my doctor, and then I had to wait maybe 6 months to see her, and then if I had problems, I had to wait another 3 months, right? So I think that's kind of where the value is packed in.
exactly.
Would you add anything there about the fees, or, kind of?
Yeah, I think, you do get a lot for what you're paying for, because it's accessibility, right, throughout that year. It's convenience, it's expert opinion, it's expert and experience that you're getting
Yeah.
from your experience. And you're also getting providers that are wholly invested in this whole thing. You're getting compassionate care, you're getting just honest and evidence-based information, and so it's just a lot of value in.
Someone just said, if you've never seen the doctor, how do you know? So you were assigned a doctor. You're gonna have a video introduction to me or you or whoever you're assigned. You can see all about us, and you were going to be like basically live messaging with us. We confirm your identity too, so we know who we're talking with, and we actually, we do develop a personal relationship with these messages back and forth, which is really great. And then once you're a customer, then we have monthly support groups and all of this other inside access to expert care, which I think is super special. And I always tell patients also that you're paying a cash price for your prescriptions, and we negotiated really, really good, rates for some things like the branded Evimis, which is very, very hard to get even through insurance, and so that's like a great value there. But as part of that, you're getting this kind of expert access that you really wouldn't get generally from a typical regular OBGYN or your internist, right? So let's move on to, so someone says, I have questions for my doctor. How do I contact them?
Mm-hmm. So once you're on the platform and become one of our patients, you have the ability to message us securely through the platform. And so it's an ongoing conversation, kind of like a chat. And so whenever questions come up and they pop in your head, you just go right into the website and message us through there.
And one of the reasons why our founders, Anne and Monica, and the team decided to make this an asynchronous platform is that we're able to really democratize it and get it to, these are OBGYN menopause specialist physicians. I love nurse practitioners, they're wonderful, but let's just be clear, on Alloy right now, it's all physicians. You're not being seen by a nurse. You're being seen by a physician in all 50 states. And we can do it on your time, and our time. Our time is flexible because it is asynchronous. So I think it really allows us to leverage specialty care to many, many more people. Because one person, you in your private practice, or me in my little private practice, we can only see so many people in a day, and we know there's, very, very few, less than 7% of doctors are competently trained in menopause care. So we're really providing access to many people. I see, it's interesting. It's not just people in rural areas who don't have access.
Yeah.
You and I see patients from major metropolitan areas who say, I cannot find anybody who will talk to me about my menopause care options, right?
Yep, that's right. And so I've loved that part of this whole experience. And you touched on something really important is, our ability to do this asynchronously allows me to take care of patients in different time zones. And so it's just way more access. And like you said, even in a metropolitan area, people have to do some really hard work to find a menopause competent provider, even in cities like New York.
Yeah.
And so, this is just really accessible to anyone.
And we're not excluding nurse practitioners. We love nurse practitioners. There's
Yeah,
amazing nurse practitioners who I think can run circles around many OBGYNs. I was just simply stating that on the Ally platform right now, everybody who you're seeing, which is different from some other platforms, is we're all physicians. But there are some amazing women's health nurse practitioners that I promote all the time, and kudos to them for filling a gap in care that many OBGYNs are not providing to their doctors. So a shout out to the excellent nurse practitioners out there. And so someone said, why would someone go to Alloy versus their normal doctor? Well, we're normal doctors, first of all, but also like kind of maybe you can answer this idea that we are not replacing you still need your routine OBGYN. You've got to get your mammogram. We want you to have your relationship with your local primary care doctors. And we're a specialist, just like you might go see a rheumatologist or some other specialist for some area of your health.
that's right. Yeah.
And I think this goes into, I'm seeing a lot of questions, Michelle, maybe you can ask about testing, blood work, like, how do we address those questions?
Yeah. So to touch upon, how does this fit into the care that I already
Yeah.
receive? Well, it's not to replace your routine screening, your gynecologic care that is still encouraged for you to do on a yearly basis. It really exists as a service for women that prefer a telemedicine experience, right? So those are some of the patients that we see through the platform. It's also for the women that don't have access or find it difficult to find someone that's experienced in hormone therapy and menopausal care. We see a lot of women, unfortunately, that are told erroneously that they're not candidates for hormonal therapy for so many reasons that are just not accurate. And so we see so many women that are just been gaslighted or denied access to care that they should be offered. So we see a lot of women like that, and so also it's a space that provides affordable medications. So we provide affordable FDA approved hormone therapy for women that it may be cost prohibitive for them to do that through their regular medical provider.
And that's a good point. I'm glad you said it. So all of the menopausal hormone therapy, obviously birth control pill options, these are all FDA approved medications. They're being shipped directly from a national pharmacy. These are not compounded systemic hormones. The vaginal estrogen is FDA approved vaginal estrogen, the patch, the pill, the spray, all of that. So we are not compounding anything that is already commercially available, because we practice by the Menopause Society evidence-based guidelines, right? So we're not doing things that are kind of not, aligned with those practice guidelines, right? And so that kind of gets into how do we vet our doctors? Let's talk a little bit about this really special group of doctors that we've formed, right?
Yeah, I mean, it's just such a unique space where brought together people who are, number one, compassionate,
Very
right?
compassionate. Yeah.
Thing that the people that are drawn to the space are called to do, and also the level of experience and expertise in the group of doctors
It's really
on this
amazing.
are except I mean it's just high level and exceptional care, and the comfort that we all feel because we're experienced and we have a really comprehensive understanding of menopausal hormone therapy.
Yeah.
And so that to be able to be in a space where we're all together in this common goal
Yeah.
of offering the service is really unique and special.
It is. And I'd say, so how do we vet the doctors? I mean, obviously, we have conversations with our team, like our founders. We'll talk to them first to make sure that they're right for Alloy. But then they get to speak to me and to you, and we really make sure that they're really practicing evidence-based care, and they're all board certified. They're all either OBGYNs, a few internists and family practice doctors who have very specialty training in menopause. Everybody's certified by the Menopause Society, and many of us go routinely in person to the big medical society meetings, and if not, we do them virtually. And then I think what's really cool is, even though we're all across the country, and some of us have many states, I've got licenses in I think 23 states now. Other doctors only have a few states, and then patients get assigned, obviously, according to states. But we do meet and we all collaborate. And so I have learned to be an even better menopause provider by
Mm,
seeing the volume of patients I see, but also because we get to connect. So we've got this special little thing that we've created called doctor office hours. So we've got our own little office
we
hours.
do.
So you want to tell them about what we do during our office hours and how it's been really, really amazing?
Yeah, I it's an opportunity that I have every month to geek out a little bit. So it's favorite things to do during the month, and we all get together about once a month and share um, evidence, studies, cases, experience, questions. So we have a continuous feedback with each other that you ordinarily may not have the opportunity to do if you're in solo practice or even in a group practice and there's nobody else providing this kind of care. You don't have that opportunity to for mentorship and community like we do. And so our office hours is something that a lot of us really love.
Yeah. Well,
And
I learn from, I mean, I learn from my patients every single day. I've learned so much from my patients. Um, and I learned from all of you, and so we each, all the doctors on the platform, we've developed a special group of doctors, and I think each of us have little areas of menopause care that are particularly important to us. So we kind of teach each other. And then we also have, which is really great, we have our own little group chat on Slack where we get to, help each other out on difficult cases. We can like flag each other. Dr. Sharon Malone is our chief medical advisor, she's amazing, and she, really helps us think big picture, and we can lean on her decades of experience and care. So we've got a lot of ways, like none of us are on our own out here, which is really nice, because sometimes when you're in private practice, I was in my own small private practice and it was just me all day by myself. And so even though we're not physically next to each other, I feel like I'm with people all day long because I know I can like message you at any time or run things
that's
by you.
right.
So
It's
I
just
think that's really important.
we're
Yeah,
elevating each other's,
we are.
and we're doing that in a very collaborative way, and so I just enjoy it immensely.
So let's maybe talk about a couple of the other things that we provide at Alloy. So, product wise, do you want to do the menopause stuff, and then I'll do maybe the skin and
Sure,
sexual health
sure,
stuff
sure.
and
So
help
we
people there.
mentioned before, all our products are FDA approved for systemic hormone therapy. They are bioidentical, and I know there's so much to that term, but
Oh, that's a good point. So we've got all the
yes,
options.
we have the option, and we have estrogen progesterone products, formulations, and so we have estradiol pills, um, estradiol patches.
I'm showing, I like props. Oops, you get the patches, go ahead.
For our visual learners, there you go. So the Eva Mist spray, those are both transdermal estradiol options. We also carry Divigel, which is another transdermal option. And maybe I'll just wait for you to pop it up on the screen. Oh, okay, so vaginal estradiol cream.
Which I
That's,
always tell patients to ditch this applicator, but you do get it with the applicator.
you know, as you're coming for planning, we can talk to you how to best use these products like the cream. We've got oral contraceptive pills as well, which can be really useful for managing symptoms in perimenopause that still need contraception.
Yeah,
And
we've got multiple different birth control pills. So we've got a progestin only option. We've got an extended regimen one. So we do have. If one doesn't work for you, we can change it. And can you just explain for people, everybody talks about bioidentical FDA approved hormones, so we've got that. But there are some people who don't tolerate progesterone, and we need to change it up. So we do have that option. Someone missed the show and tell, so I'll just while you're talking, I'll just show people pictures. Do you want to talk about, why don't you tell us about the sexual health and the skin health stuff?
correct. So this part I do get very out because we have a product called the M4. And so I think what's important to highlight is that women in this transition have really abrupt changes in estrogen levels, which not only affect physiologically, internally, but also on their skin. And so a lot of women see dramatic changes. And we know that estrogen works below the belt to help with, some of the things that happen, loss of estrogen. And we've also know that estrogen helps with skin and the changes that happen there as we lose estrogen in age. Those are abrupt changes, the loss of collagen and elasticity and change in texture. We know we actually, yes,
So I'm going to show you, we'll go one through one. So you're talking right now,
and for estriol cream.
Estriol cream. And so here, if anybody wants to see it, I'll put it on my hand. Okay.
I love this stuff. I'm not trying to plug, but personally, and so that can be on a daily basis, face, neck, anywhere that you see those changes of loss of estrogen.
And let me just stop you so I can ask you some questions about M4 because I know people are going to be asking about this. So when we're going to M4 cream, this is not for hormone therapy.
It is
We do not prescribe any hormone therapy creams that are compounded.
correct.
This is one of the few products that are compounded because, and this could be a whole nother Instagram live, but women do not have access to a FDA approved version of estrogen face cream. And again, we could go on and on about this, but you alluded to that we have vaginal estrogen cream that's been around for decades.
Yes.
In the US, it's estradiol cream, and in Europe, for the vaginal cream, the standard is actually estriol. So we know that estrogens work on skin because we've used it for years on the vulva, the vagina, right? And so basically, it's a similar concept, and it's not systemic. This is not treating hot flashes.
No.
This is to improve texture, collagen, and keeping your skin healthy as you get older. And it's not meant for a woman who is 30. Estrogen face cream is meant for a perimenopausal, menopausal woman who's losing the estrogen stimulation in their skin, right?
Some women may see benefit, who are younger, to the M4 cream, and it actually is a moisturizer.
Yes, it's in a moisturizing base, yeah.
But it may have more dramatic impact on women who are experiencing signs of estrogen deprivation.
Yes, and people always ask us, we get some common questions. It's not systemically absorbed. It does not require you to take a progesterone if you're using it, just like vaginal estrogen. You don't have to take a progesterone if you have a uterus and you're using it. It can be used with hormone therapy. It can be used with a birth control pill. It could be used on its own. You could have contraindications for systemic estrogen, right? reasons why we would not give you HRT, but you could use vaginal estrogen or you can use the face cream.
And it can be used with your routine skin regimen as
Yes.
well. No issue.
And M4 face cream is not an FDA approved product. It's a compounded product. What proof is there that it improves skin? If you go to the website, we have we have all the data linked for the studies that have been done, showing that it is safe and quite effective. And we have decades and decades of data of what we know estrogens do topically, because it's the standard of care for treating the loss of collagen and vaginal dryness and thinness of the skin on the vulva, the clitoris, the vagina, all of that. So skin up here too.
It makes
Works out.
Yes.
And then maybe we'll just show people. So the other skin thing is, which is a nice thing, is the tretinoin. It comes in different versions, different strengths, and ours is made with niacinamide and aloe. So is there anything you want to say about that, or about how patients layer it, or whatever?
All right.
And I'll show.
Use retinol products as anti-aging products, and so this is something to just complement what they may want to achieve with their M4, and they can do that through aloe as well, and it ships to your door. It's just really easy and convenient.
And then sexual health care. Obviously, sexual health care is a holistic approach, right? Sexual health care sometimes is talking about menopausal hormone therapy, and vaginal estrogen, which we've always mentioned. So if you're having problems with arousal or orgasm and pain for sex, I mean, we're always going to recommend vaginal estrogen as a frontline mainstay. But we do have another interesting option. So do you want to also?
So it is a product called Amazing, made with sildenafil, which is actually the generic form of Viagra. And to your point, I mean, the tissue has to be healthy, right? So vaginal estrogen is a really important component to that sexual health, and to improve sensation and comfort. And so the sildenafil cream is actually used to improve sensation, arousal, and for some women, the intensity of orgasm. And so it's intended to be used in the moment, versus the vaginal estrogen it can be part of how we address the issues with loss of sensation and problems with intimacy. So vaginal estrogen is a really important part of that. The Amazing cream is something else that we can use to improve women's sexual experience.
Yeah, and I think it's great that I think we want to point out is one of the goals and missions of Aloe is to provide access to evidence-based, science-based options. So we've got lots of FDA-approved, evidence-based, science-based options, and then there's a few things that women have been denied access to, and one is this application of a topical, basically Viagra, sildenafil, which actually at the recent sexual medicine conference, ISHRA's conference, there was very, very interesting data showing that this does work and can really help women get a lot of blood flow and increased sensation to the clitoris and the vulva. So that's a fun, I always say it's like that fun second layer when you've got the vagina and vulva properly treated with vaginal estrogen, if you need that. So that's fun. And then two questions that have come in that you can answer. Can you talk to us about testosterone and aloe? And why don't you hit that and I'll hit the breast cancer question.
Yeah, a lot of questions about do we believe in testosterone therapy, number one, and do we offer it?
We believe in it, and we will tell you right off the bat, we believe in it.
Love to offer it, but there are some restrictions with us being able to prescribe. And the logistics of that are just a little bit, just not something that we have the ability to do right now. We would
working on it,
but because it is a controlled substance, it just creates some limitations in our ability to prescribe interstate and also monitor those patients.
Yeah. If anybody's interested in this, it's really an advocacy thing that we should be banging on the FDA and the DEA to consider making testosterone not a controlled substance, and for the medical world to and the pharmaceutical companies to understand that it is a female hormone too. But what I tell patients is we are going to help you feel your best, and many, many, many women, when they're properly treated with menopausal hormone therapy, with their vaginal estrogen, they may not absolutely need the testosterone. And if they do need it, you know, one nice thing about Alloy is we're not gatekeepers. So if a patient comes to me and there's something that they might need that I can't offer them an Alloy, or something that they need, we can just, we point them in the right direction. We can say like, hey, we can offer you this, we can help you here, but you need this. And that might, you know, kind of we're going to wrap this up in a bit, but that might also hold true with, you know, if there's a complication, if you're getting bleeding, if there's things that are going beyond the limit that we can do for you here, we are going to help point you in the right direction. And we are never going to work against your doctors. We're going to work in collaboration. Patients can request a copy of their chart. They can then bring it to their doctor. You know, we can, you know, have open communication, and, you know, we're just part of the team, right?
You,
And no, we don't
I know a lot of times.
ask the blood work
Yeah,
question that just came in. Yeah.
if you want to address
Yeah.
that
Yeah,
before we close.
for sure. Go ahead. Oh,
Well,
I'm giving
I'll
you the blood work
let you
question.
take that one.
Oh, you want me to take a blood work one?
Yeah.
All right. So, you know, what we tell patients is we practice evidence-based guidelines from the Menopause Society, which we know in the perimenopause, there really is no role for blood work in determining whether you're perimenopause or not, because your hormones are all over the place in perimenopause. And then in menopause, we know what your estrogen and progesterone are. They're really low. And so we don't need a baseline to initiate treatment. And we don't choose the dose based on a blood test. We choose the dose based on what are your symptoms, what's your medical history, and we choose the dose that treats your symptoms by minimizing side effects. And then we adjust the dose based on feedback. How are you feeling? You know, are you having side effects? We can adjust the dose or formulation. So that's how the Menopause Society guidelines that are supported by AGOG and all of the medical organizations, that's what they recommend. And if there's something in your intake that says, oh, you need more, some other testing, we will give you that direction. And sometimes we can treat you at the same time as we also recommend you to go seek out some other care from your in-person doctor. Let's hit the breast cancer question because it comes up constantly. Right now, breast cancer survivors can come to Alloy to get access to any of the topicals, the vaginal estrogen. We do have a non-hormonal option called paroxetine for hot flashes that many breast cancer survivors could use as a non-hormonal. I believe certainly me, if you follow me on Instagram, you'll know, and many of the doctors, we all want to provide even more access to shared decision-making, informed consent, and the option, depending on the case, to systemic hormone therapy, but it's a special situation. It requires in-depth, a little bit more in-depth consultation, sometimes a review of records, a true informed consent. So it doesn't mean that we're leaving breast cancer survivors high and dry. When you come to us, we're going to help you with non-hormonal things. We're going to help you. You can get vaginal estrogen, any of the skincare stuff, and we provide a lot of advice and resources and sometimes referrals. And we're working really hard to figure out a special lane because we know these women are really neglected out there. So we hear you, and we can support you in many ways. And anything that you would want to add to that?
Yeah, yeah. I think, you know, we definitely recognize there's such a huge need to be able to support survivors of breast cancer, and they're really suffering. And so I know that all the doctors, we feel really passionate about that. And as we grow and you know, become you know, we spend longer on the platform, our goal is to be able to figure out a way how we can make it possible to meet that need, and we're working on it.
Yeah, because you know, in medicine and in life, nothing's absolute. There's, you know, things are relative, and you know, we do balance relative risks and benefits, and certainly there are some situations where there's hard no's, but very often there's room for at least discussion. So we're going to try to give some of that information and discussion to you, give you some of the options, and you know, we're working on that for sure. let's see, we should probably respect everybody's time. We're going to wrap this up. Is there anything, Michelle, that I left out that you'd want to tell our audience?
I mean, I think I'm just really just grateful to have the opportunity to jump on and, you know, for our patients and women to be able to see who we are, who the doctors are, you know, why we're here, what we're passionate about, and you know, it's just been a lot of fun.
And it came up a couple of times. They asked, are all the doctors Menopause Society certified practitioners? I'd say almost all of them are. There's a couple who don't have the official certification, but they are highly trained and have done the CMEs and have participated at the conferences and are very menopause literate. And I think almost everybody is officially also
Yeah.
certified. So you're really in good hands.
Yeah, the certification is not necessary if a provider has high levels of expertise and experience and all that. So,
Yeah,
yeah.
awesome. Okay, well, we're going to be doing more of these because we want to bring the doctors who are, you know, behind the computer to the audience. So stay tuned. Michelle and I will be doing more of these with some of our other physicians on the
Yes.
platform. So thank you so much for joining us, everybody. And any of your friends who missed it, if they're curious about how Alloy works, just tell them it's going to be on my feed, on your feed, and also on Alloy's feed, of course. And oh, last plug, we've got an incredible YouTube channel.
Oh, it's so good.
It's like a free master class from literally every expert who you hear about speaking publicly these days. We've got them all,
It's like
and it's free.
get a sneak peek into our office
Yeah,
hours. That's
it's
kind
really
of
good.
like,
Yes, go check out the Alloy
yeah,
YouTube channel.
really good.
All right.
All
Thank
right.
you for joining me, Michelle. Now let's get back to seeing patients.
All right. Bye.
Bye.